Dear students, after studying this module, you shall be able to know about what is anxiety, symptoms of anxiety disorders, panic disorder, its theories and treatment, phobias, types of phobias, its theories and treatment, generalized anxiety disorder, theories and treatment, obsessive-compulsive disorder, its theories and treatment, and some social approaches to the anxiety disorders. First, the introduction. Anxiety is a feeling or emotion of worry, nervousness or unease about something with an uncertain outcome. Anxiety is a prominent feature in many psychological disorders. Anxiety has psychological and somatic, emotional, cognitive, and behavioral symptoms. Now we shall discuss about the symptoms of anxiety. First are somatic symptoms. Somatic symptoms are goosebumps, tense muscles, increased heart rate, accelerated respiration, deepened respiration, spleen contraction, dilated peripheral blood vessels, widened bronchioles, dilated pupils, increased perspiration, adrenal secretion, inhibited stomach acid, decreased salivation, and bladder relaxation. Second, emotional symptoms. Emotional symptoms are sense of dread, terror, restlessness, and irritability. Third, cognitive symptoms. Cognitive symptoms are anticipation of harm, exaggeration of danger, problems in concentrating, hypervigilance, worried, ruminative thinking, fear of losing control, fear of dying, and sense of unreality. Fourth, behavioral symptoms like escape, avoidance, aggression, freezing, decreased appetite responding, or increased aversive responding. All these are the symptoms of anxiety. Freud and many other specific theorists believe that anxiety was the underlying cause of most forms of psychopathology. He used the term neurosis to refer to disorders in which the anxiety aroused by unconscious conflicts could not be quelled or channeled by defense mechanisms. This anxiety could be experienced more or less directly as conscious symptoms of anxiety. It could also take a number of maladaptive forms, such as depression or hypochondriasis. The DSM no longer uses the term neurosis. Instead, it classifies disorders in which the predominant symptoms are anxiety as anxiety disorders. Research suggests that some people do have a general tendency toward anxiety from a very early age. This tendency is sometimes referred to as neuroticism. Children who are neurotic or behaviorally perceive their parents as being less accepting of them as parents tend to be overprotective, controlling, and intrusive. Now we shall discuss about panic disorder. A panic attack is a short, intense experience of several of the physiological symptoms of anxiety, plus cognitions that one is going crazy or losing control or dying. First, we will discuss about the symptoms of a panic attack. These are the common symptoms of a panic attack. Occasional experiences of these symptoms are common. When 4 or more symptoms occur frequently and interfere with daily living, the individual may be diagnosed with panic disorder. First is heart palpitations, pounding heartbeat, numbness or tingling sensations, chills or hot flashes, sweating, trembling or shaking, sensations of shortness of breath or smothering, feeling of choking, chest pain or discomfort, nausea and upset stomach, dizziness, unsteadiness, lightheadedness or faintness, feeling of unreality or being detached from oneself, fear of losing control or going crazy, or fear of dying. The diagnosis of panic disorder is given when a person has spontaneous panic attacks frequently, begins to worry about having attacks, and changes his or her ways of living as a result of this worry. Now, theories of panic disorders. First, biological theory. Biological theory of panic disorder is that these people have overreactive autonomic nervous systems, which put them into a full fight or flight response with little provocation. This may be the result of imbalances in norepinephrine or serotonin, or in hypersensitivity to feelings of suffocation. There also is some evidence that panic disorder may be transmitted genetically. Second, psychological theories. Psychological theories of panic suggest that people who suffer from panic disorder pay very close attention to their bodily sensation, misinterpret bodily sensations in a negative way, and engage in snowballing, catastrophic thinking. This thinking then increases physiological activation and a full panic attack ensues. Next, we will discuss about the treatments for panic disorders. Tricyclic antidepressants, selective serotonin reuptake inhibitors, and benzodiazepines are effective in reducing the symptoms, but people tend to relapse into these disorders when they discontinue these drugs. An effective cognitive behavioral therapy has been developed for reducing panic symptoms. Clients are taught relaxation exercises and then learn to identify and challenge their catastrophic styles of thinking, often while having panic attacks induced in the therapy sessions. Next is phobias. Phobia is a type of anxiety disorder. Types of phobias. People develop phobias of many things. In this section, we will consider three groups of phobias. First, agoraphobia, specific phobia, and social phobia. Agoraphobia. People with agoraphobia fear a wide variety of situations in which they might have an emergency but not be able to escape or get help. Many people with agoraphobia also suffer from panic disorder. Second, specific phobias. The specific phobias include animal type phobias, natural environment type phobias, situational type phobias, and blood injection injury type phobias. Third, social phobias. People with social phobia fear social situations in which they might be embarrassed or judged by others. Now we'll discuss about these phobias in detail with some examples. Agoraphobias. Description is fear of places where help might not be available in case of emergency. Examples are: person becomes housebound because any place other than the person's home arouses extreme anxiety symptoms. Next is specific phobia. Fear of specific objects, places, or situations. First is animal phobia. Specific animals or insects. Example is person has extreme fear of dogs, cats, or spiders. Second is natural environment type phobia. Events or situations in the natural environment. Example is person has extreme fear of storms, heights, or water. Next is situational type of phobia. Public transportation, tunnels, bridges, elevators, flying, driving, etc. Examples: person becomes extremely claustrophobic in elevators. Next type of phobia is blood injection injury type. Person is phobic to blood, injury, or injections. Example is person panics when viewing a child's scrapped knee. Next is social phobia. Fear of being judged or embarrassed by others. Example: person avoids all social situations and becomes a recluse for fear of encountering others' judgment. Now there are various theories associated with phobias. First is psychodynamic theories. And these theories of phobias suggest that they represent unconscious anxiety that has been displaced. These theories have not been supported, however. Second is behavioral theories of phobia suggest that they develop through classical conditioning and are maintained by operant conditioning. Humans may be evolutionarily prepared to develop some type of phobias more easily than others. Third, cognitive theories. They have focused on social phobia and suggest that this disorder develops in people who have excessively high standards for their social performance, assume that others are judging them harshly, and are hypervigilant to signs of rejection from others. Fourth is biological theories. These theories of phobias attribute their development to heredity. Now the theories, their description and the examples. Psychodynamic theories, description. Phobias result when unconscious anxiety is displayed onto a neutral object. Example, little child developed a horse phobia which represented his Oedipal fears of his father. Second is behavioral theories. First, classical conditioning leads to fear of the object when it is paired with a naturally frightening event. Example, a child who falls into a river and cannot swim develops a fear of water. Under behavioral theories, second is avoidance of the object reduces anxiety. Thus, it's reinforced through operant conditioning. Example, a person with agoraphobia learns that by staying in her apartment, panic attacks are less likely, and thus staying in her apartment is reinforcement. Under behavioral theories, third is humans are prepared through evolutionary history to develop phobias to objects or situations that were dangerous to our ancient ancestors. Example is humans develop phobias to spiders and heights more easily than to guns or power lines. Next theory is cognitive theory. Under this theory, the description given is social phobia develops in people with excessively high standards for their social performance, who assume others judge them harshly and who are attentive to signs of social rejection. Example is a man who believes that he always stammers in conversations and that others think he is stupid as a result might develop a social phobia. Next important theory is biological theory. Description is genetics contribute to risk for phobias either directly or by creating certain temperaments that are more prone to phobias. Example, children with phobias often have relatives with the same phobia, or the children tend to be excessively timid or shy. Now we shall discuss about the treatment for phobias. Behavioral treatments for phobias include systematic desensitization therapy, modeling and flooding. Cognitive techniques are used to help clients identify and challenge the negative, catastrophizing thoughts they have when anxious. Group cognitive therapy has proven highly effective in the treatment of social phobia and in preventing relapse. The benzodiazepines and antidepressant drugs can help quell anxiety symptoms, but people soon relapse into phobias after the drugs are discontinued. The next type of anxiety disorder is generalized anxiety disorder, also known as GAD. First, we shall discuss about the symptoms of GAD. People diagnosed with GAD must show excessive anxiety and worry, difficulty in controlling the worry, and at least 3 of the other symptoms on this list chronically for at least 6 months. First, excessive anxiety and worry. Second, difficulty in controlling the worry. Third, restlessness or feeling keyed up or on edge. Fourth, easily fatigued. Fifth, difficulty concentrating, mind goes blank. Sixth, irritability. 7th, muscle tension. 8th, sleep disturbance. All these are the symptoms of GAD. Now we shall discuss about the theories of GAD. These are the major theories of GAD. First is psychodynamic theory. First theory was given by Freud, also known as Freud's theory. Generalized anxiety disorder results when impulses are feared and cannot be expressed. Now the latest or the newer psychodynamic theories. Children whose parents are not warm and nurturing develop images of the self as vulnerable and images of others as hostile, which results in chronic anxiety. Second theory is humanistic theory. Generalized anxiety disorder occurs in children who develop a harsh set of self-standards they feel they must achieve in order to be acceptable. Next theory is existential theory. GAD is due to existential anxiety, a universal fear of the limits and responsibility of one's existence. Next is cognitive theories. Both the conscious and the unconscious thoughts of people with GAD are focused on threat, leading to chronic anxiety. Next theories are biological theories. First is GABA theory and next is genetic theory. GABA theory. People with GAD have a deficiency in GABA receptors, resulting in excessive firing in the limbic system. Next is genetic theory. A biological vulnerability to GAD is inherited. Now we will discuss about the treatment for generalized anxiety disorder. Cognitive behavioral treatments for people with generalized anxiety disorder focus on helping them confront their negative thinking. Drug therapies have included the use of benzodiazepines and a newer drug called buspirone, as well as tricyclic antidepressants and the selective serotonin reuptake inhibitors. Next disorder is obsessive-compulsive disorder, also known as OCD. Obsessions are thoughts, images, ideas, or impulses that are persistent, that the individual feels intrude upon his or her consciousness without control and that cause significant anxiety or distress. Compulsions are repetitive behaviors or mental acts that an individual feels he or she must perform. Obsessive-compulsive disorder, OCD, is classified as an anxiety disorder because people with OCD experience anxiety as a result of their obsessional thoughts and when they cannot carry out their compulsive behavior. This disorder has a quite different character than the other anxiety disorders that we have discussed so far. First, we shall discuss about the symptoms of obsessive-compulsive disorder. Obsessive-compulsive disorder is classified as an anxiety disorder but differs from other anxiety disorder in many ways. The person must have either obsessions or compulsions which he or she recognizes are excessive or unreasonable. Obsessions are defined as recurrent and persistent thoughts, impulses, or images that are experienced as intrusive and inappropriate and that cause anxiety or distress. Thoughts, impulses, or images that are not simply excessive worries but the real life problems. Thoughts, impulses, or images that the person attempts to ignore or suppress or to neutralize with some other thought or action. Obsessional thoughts, impulses, or images that the person recognizes are a product of his or her own mind. Compulsions. Compulsions are defined as repetitive behaviors such as hand washing, ordering, checking, or mental acts such as praying, counting, repeating words silently, that the person feels driven to perform in response to an obsession or according to rules that must be applied rigidly. Behaviors or mental acts that are aimed at preventing or reducing distress or preventing some dreaded event or situation. However, these behaviors or mental acts either are not connected in a realistic way with what they are designed to neutralize or prevent, or are clearly excessive. Now, we will discuss about the theories of obsessive-compulsive disorder. The biological theories of OCD have been dominant in recent years, but psychodynamic and cognitive behavioral theories have also been proposed. Now, we shall discuss about these theories. First theory is biological theory. People with OCD suffer from a dysfunction in the circuits in the brain regulating primitive impulses, possibly due to deficiencies in serotonin, which causes OCD. Psychodynamic theories. The obsessions and compulsions of people with OCD represent unconscious wishes or conflicts. Next theory is cognitive behavioral theory. People with OCD have difficulty turning off intrusive thoughts because of chronic distress, a tendency toward rigid thinking, and the belief they should be able to control their thoughts. Now, we shall discuss about the treatments for obsessive-compulsive disorder. The most effective drug therapies for OCD are the antidepressants known as selective serotonin reuptake inhibitors. Cognitive behavioral theories have also proven helpful for OCD. These therapies expose OCD clients to the content of their obsessions while preventive compulsive behavior, so that the anxiety over the obsessions and the compulsions to do the behaviors are extinguished. Now, what are the social approaches to the anxiety disorders? Social perspectives on the anxiety disorders focus on differences between groups in the rates and expressions of anxiety disorders. Women have higher rates of almost all the anxiety disorders than do men. Social theories suggest that women are chronically anxious because they fear separation from others or because they truly are in greater danger of sexual or physical abuse than are men. Another theory is that men are punished for exhibiting signs of anxiety, whereas women are not. So, men cope with their anxiety through adaptive or maladaptive activities, whereas women go on to develop anxiety disorders. Cultures may differ in their expression of anxiety disorders, or they may have distinct type of anxiety disorders not found in other cultures. Now, the summary. Anxiety is a prominent feature in many of the psychological disorders. Anxiety has physiological and somatic, emotional, cognitive and behavioral symptoms such as goosebumps, dilated pupils, irritability, restlessness, exaggeration of danger, hypervigilance, aggression, avoidance, etc. Panic attack is a short, intense experience of several of the physiological symptoms of anxiety plus cognitions that one is going crazy, losing control or dying. People can develop phobias of many things like agoraphobia, fear of places, specific phobia, fear of specific objects, places or situations, and social phobia, that is fear of being judged. People diagnosed with generalized anxiety disorder, GAD, show excessive anxiety and worry, difficulty in controlling the worry. Obsessive-compulsive disorder, OCD, is classified as an anxiety disorder wherein people have obsessional thoughts or compulsions which they recognize are excessive or unreasonable. Biological, psychological, and behavioral theories about panic disorder, phobias, generalized anxiety disorders, and obsessive-compulsive disorders have also been discussed. Treatments using drugs such as tricyclic antidepressants and benzodiazepines for the symptoms of anxiety disorders. Also, therapies like cognitive behavioral therapy have been found useful in reducing the symptoms of anxiety disorders.